Hi, my name is Alan Savoy. I am a gastroenterologist. I work at the Oregon Clinic, GI East. I was 19 to 20 years old when I first realized I wanted to become a physician. I was in the military at the time, and I was chosen to take an ACLS class, Advanced Cardiac Life Support. And back in the 80s, that was a very difficult class to pass. I was one of 26 students in there. All of the students were nurses and physicians. I was the only enlisted person in the class, and only 2 people out of the 26 passed. And I did well enough, they sent me to instructor school for that. And when I passed that class and I saw what I did with no college education against doctors and nurses, I decided that's what I needed to do. I definitely know my brain is different than a lot of my partners. I think about things differently. I form different relationships with patients and staff, other providers because of it. I'm not a traditional physician in the sense of having had physician parents. I grew up blue collar and had to struggle for everything in my life, and I've lived on both sides of the tracks and come to understand and relate to people in those ways. Things that I find the most challenging and rewarding in what I do is the advanced endoscopic procedures that I do. I'm on the advanced polyp team, which is a service that we provide where gastroenterologists that are not comfortable removing large polyps will send those my way. I do endoscopic ultrasound and ablative therapies for Barrett's esophagus and esophageal cancer. And the technologies have advanced so much in the last 10 years that I'm able to physically remove cancers on my own, which I find insanely rewarding. You know, when I'm not at work, I spend most of my time playing music. I'm a fairly accomplished percussionist and drummer, and I'm currently learning to play the harmonica. I play in local bands around town and have been in recording bands. I have a recording studio in my home. So music is my #1 passion outside of medicine.